my name is Sharon. I'm here to do your examination. And the medical assistant has already done your vital signs, your hearing, your weight, your vision, and I'm going to clean my hands. So I've washed my hands in the sink, and I'm going to proceed to examine you. Okay, is it okay if I start your examination now? You're here for a well visit?
Yes.
Okay. I'm going to start by looking at your scalp and your face. You have facial symmetry present. I'm going to feel the scalp, looking for any lesions, any nevus, any infestations. The hair is nice and clean. She has good hygiene. There's no lesions. Scalp is symmetrical. I'm going to have you remove your mask here. I'm going to take a look at your face. I am checking for facial symmetry, and I'm checking for any lesions. She has some comedones. First thing I'm going to do is I'm going to take a look at your eyes. So I'm going to grab my pen light here. I want you to just look over my shoulder, and I'm going to shine a light at your eyes, okay? I'm looking for the corneal light reflex, and I do see it present in both eyes. Next thing I'm going to do is check her pupils. I'm going to check your left pupil first. Just look straight ahead, okay? Pupils equal, reactive, round to light to combination. Right eye, okay, perla, both eyes, okay, conjugate, looks good. I'm going to have you follow my finger with your eyes only. I'm checking cranial nerve 3, 4, and 6, using the cardinal signs of gaze. Good. Follow my finger in. All right, I do not see any extraocular eye movements. Cardinal signs of gaze, cranial 3, 4, and 6 are intact. Next thing, I'm going to check your conjunctiva. I'm taking a look here. Okay, it looks pink and moist. Your eyelashes curl out and up appropriately. I'm going to check with my ophthalmoscope. Taking a look at your eye now. This light's going to be really bright, okay? I just want you to kind of look over my shoulder here. I'm going to come in and look first for the red reflex. And I see the red reflex. I'm going to have to get a little bit closer. I'm checking your optic nerves. Okay, I can see your optic nerves, and they are no cupping, no negging. And I see the optic disc and everything that's creamy orange. Let me check on the other side. All right, red reflex. Coming in closer. Let me look with this eye. I see your optic disc, the nerves, and no cupping, no nicking, and it's creamy orange. Okay, next I am going to just palpate your ethmoid sinus, any tenderness, your maxillary, and your lacrimal ducts. Any tenderness there?
No.
Okay, perfect. Looking at your ears, your pinea of your ear lines up with the outer canthus of your eye. Palpate your ears. Any tenderness?
No.
I'm going to take a look inside your ears next. Just change out my equipment here. Alrighty. Now, Angelina is a young adult, so I'm just going to check it as I would for an adult. I'm first inspecting the ear canal. There's no cerebrum. I'm going to pull your ear out, up. Looking in the right ear. Tympanic membrane's pearly gray. No redness, no bulging. Cone of light is at 5 o'clock. I'm going to check your left ear. Inspecting the ear canal. There's no cerebrum. Pull your ear out and up. Cone of light is at 7, and tympanic membrane's pearly gray, no redness, no bulging. Next, I'm going to check your nose. Okay, I'm going to get down here, looking up here with the light. I don't see any deviation. Turbinates are present, and her nasal mucosa is moist, pink, intact. Next, I'm going to take a look in your throat. If you can open up your mouth for me, please. Okay, and I'm going to use a popsicle stick and want you to say, ah. Okay, good. So I'm checking your cranial nerve 9 and 10, and they're intact. And I want to take a look at your hard palate. It is fused. I do not see any dental caries. Can you stick your tongue out? Tongue protrudes midline. Move your tongue side to side. Okay, good. Lift your tongue up. Okay, soft palate, moist. Buccal membranes, moist. And she's articulating her words, so cranial nerve 12 is intact. Okay, next, I am going to palpate your lymph nodes. Pre-auricular, post-auricular, posterior cervical, anterior cervical, submaxillary, submental. I'm going to go down and check the clavicular. Okay. Next thing, I'm going to check your thyroid. So I'm going to come behind you, rest my hands here on the clavicle. Take it like you're going to swallow a drink of water for me. Good. No tenderness noted anywhere in your neck here?
No.
Okay. And there's no nodules or no firmness noted. Next thing, I'm going to, I would like you to take your right hand. I want you to cover it over your right eye for me. Okay, uncover it. Left hand, do the same. Okay, checking for any wandering. There's no eye wandering. The cover test is intact. I'm going to just check your shoulders here. I want you to push up against my hands. Good, push against my hand and push against my hand. Cranial nerve 11 is intact. I'm going to have you clench your jaw, open and close. Okay, and move your jaw side to side. Any tenderness?
No.
Trigeminal nerve 5 is intact. Next thing I'm going to do is just palpate your shoulders. The Acromion process is my marker. Okay, any tenderness here?
No.
Any tenderness here?
No.
Any tenderness in here?
No.
Any tenderness here?
No.
Okay, capillary refill, brisk. Can you move your arms up and down? I'm going to check the motion of your upper extremities. Move your wrists, open your fingers. Anything tender there?
No.
Okay. I'm going to check your deep tendon reflexes. I'm going to relax your arm for me. I'm going to check your tricep. Good. I'm going to check your bicep. Good. And I'm going to check your brachial radialis. Good. Tricep. Relax your arm. Okay. And brachial or bicep, and then brachial radialis. Okay. Good. Next, I'm going to check your skin of your back and inspect your posterior chest. Can you turn to your side for me a little bit? Perfect. Looking at your scapula, looking at your chest, it's symmetrical. Looking at the front, anterior, posterior is 2 to 1. Okay. I'm going to take a listen to your lungs. I want you to just take a deep breath in and out when I put the stethoscope on your chest, okay? Okay? Very good. Next thing, when you feel the stethoscope against your chest, I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, that is vocal fremitus, and the sound is muffled as we're going down. The next thing I'm going to check is for tactile fremitus. I put my hands against your chest, and I want you to say 99 every time you feel my hands against your chest.
99. 99. 99. 99.
Okay, vibrations are lessening as we're going down. I'm going to put my hands against your chest, and I want you to take a deep breath in. I'm going to check for chest symmetry here. Okay, chest expansion is symmetrical. I'm going to percuss your lungs next, and I'm going to start at the upper chest. Can you move your arm a little bit? Okay, I'm going to do the same thing to the other side. All right, resonant. I'm going to have you turn now forward for me. You're doing a great job. I'm going to check your carotid arteries one at a time. Okay, 2 plus. Okay, checking for bruit with the bell of my stethoscope. No bruit. No bruit. I'm going to check your breath sounds on the front of your chest. I see that your chest is symmetrical. Again, I do not see any lesions. I've inspected her skin with her gown off on anterior and posterior aspects. Okay, relax your arms. Every time you feel this against your chest, I want you to take a deep breath in and out. Perfect. Breath sounds are clear bilaterally, anterior and posterior chest. I'm going to check now your heart tones. Actually, let me listen with my diaphragm first. Okay, just breathe normal for me. So I'm listening for the apical, pulmonic, Erb's point, tricuspid, mitral, normal S1, S2. I'm going to check again with my bell as well. Okay, apical, pulmonic, Erb's point, tricuspid, mitral. Okay, no gallops, no murmurs, S1, S2. I'm going to check for your point of maximal impulse. So can you lift your breast tissue up for me? About the 5th intercostal. And I can feel her apex of her heart. Next thing I'm going to do is I'm going to have you move to the couch. So I'm going to need you to lie down. Perfect. Yep. Lay this way for me. Perfect. Okay. I am going to just take a listen to your abdomen first. I'm looking at your skin. It's symmetrical, and I do not see any peristaltic waves. There's no lesions, no nevus. I'm going to take a listen to your bowel sounds. Okay, listening at all 4 quadrants, and they're present. Bowel sounds are present, normal, active in all 4 quadrants. I'm also going to listen for any bruits, aortic, no bruit, renal, no bruit, no bruit, iliac, no bruit, no bruit. Inguinal, she would have a gown on, and I'd be listening right in this region here. And again, no bruits noted. Next, I'm going to just palpate your abdomen, or I'm sorry, percuss your abdomen. Okay, any tenderness? And I hear tympani. Okay, I'm going to palpate your percuss your spleen, mid-axillary 6th intercostal. It's about right here. So I'm percussing. Okay. Some dullness noted over that organ. Then I'm going to check your liver. I'm going to percuss your liver, top down and bottom up. Okay, can you relax your arms inside? Thank you. Starting to get dull right there. Looking for the umbilicus, and I'm going to head back up. Dullness there. So it's about 4 centimeters. Next, I'm going to palpate your abdomen in a circular motion. Any tenderness?
No.
Okay. No masses. I don't feel anything that's concerning here. Next, I'm going to palpate your spleen, anterior, posterior. Any tenderness?
No.
I'm going to palpate for your liver. Can you take a deep breath in? Okay, and blow out. Any tenderness?
No.
I'm going to palpate each kidney. I'm going to start on the left side. Any tenderness?
No.
Any tenderness?
No.
McBurney's point, umbilicus to iliac crest, 2/3 of the way. I'm gonna press down and then let up. Tell me if you have any tenderness.
No.
Okay. Relax your legs for me. I'm gonna squeeze your, kind of touch your hips here first. Any tenderness here?
No.
Squeezing your hips together. Any tenderness?
No.
Okay, perfect. I'm gonna have you come on and sit back up in this chair for me. Okay. Next, I'm gonna check your range of motion to your lower extremities, and I'm inspecting the lower extremities, her thighs, her knees, her calves, her ankles, her feet. They're all symmetrical. She has some abrasions. She went camping last weekend and has some mosquito bites. Next, I'm going to check for some, first I'm going to check your range of motion. So let me have you bring your knee up. Good. Bring this other knee up. Good. Can you kick your legs out? Good. And bring them back. Okay. Can you bring your feet and kind of rotate them inward? Okay. Inversion and eversion. Perfect. And can you move your ankles all around? Any tenderness there?
No.
Range of motion looks intact. I'm going to check your patellar reflex. Okay. And then I'm going to check your Achilles tendon. Okay. And then just checking for the plantar reflex. Okay. DTRs are 2+ in all extremities. And then I'm going to have you go ahead and stand up for me. I want you just to walk to that chair, and when you stop there, turn around and look at me. Walk back towards me on your toes. Okay, gait looks steady so far. Turn around and walk on your heels back to that chair. Okay, gait looks steady. I want you to walk with your one foot in front of the other towards me. Gait looks steady. Okay, turn around, face this window. I want you to close your eyes, and before you do that, I want you to stick your arms out and hold your palms up. Okay, close your eyes. Okay. Good, and you can relax. I do not see any swaying there. Romberg test is intact. Next thing, I'm going to palpate your spine. Let's have you turn this way. I'm going to take a look at your back. Symmetrical. I'm going to palpate down your spinous processes. Any tenderness?
No.
Okay, good. Let's have you bend over. Kind of touch your toes. Checking that spine. There's no curvature. Any tenderness in here?
No.
Okay, range of motion to the spine and back is intact. Turn around. We're going to check for some cortical sensation, and I want to first start with proprioception. Okay, I'm going to just kind of grab your hand, close your eyes, and I'm going to move a finger. You tell me what direction I'm moving in.
Up. Down.
Okay, perfect. Next, I'm going to check your graphophagia. I'm going to just write something in your hand, and you tell me what it is.
C.
Perfect. Okay. Next, I'm going to check your stereogenesis. Close your eyes for me. Okay. Tell me if you can feel what this is and what is it?
A remote.
Okay. Perfect. And then I'm going to check your exteroception. And I just want you to tell me if this feels like hard or soft. Okay.
Hard. Soft.
Okay. Perfect. So those cortical sensations are intact. The last thing we could do, I know the MA did a hearing test, but we could do the Rhine test or the Weber test to confirm that, or we could also do a whisper test where I would whisper 3 different, like a letter or a number in her ear, and she would be able to tell me what those are. Okay, so I think this concludes our physical examination. This is Sharon Thews, Spring Arbor University.